Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. Factors affecting or regulating the GH secretion. So the first one is the stimuli that increase the GH secretion. So what is it? So the stimuli which increase the GH secretion, it includes the GHRH. There is testosterone, estrogen, ghrelin, glucagon, the decrease in blood glucose, the decrease in the blood glucose. Next is the decrease in FFA, the increase in the amino acid, there is arginine increase, the fasting of the protein deficiency in case of exercise too, then trauma, stress, excitement, and drugs like the apomorphine and also the L-dopa. Now looking at the stimuli that decrease the growth hormone secretion. This includes the somatostatin. So somatostatin, then the exogenous GH, then the somatomedins, the cortisol, the increase in the blood glucose, then comes the increase, this is in the FFA, the REM sleep, obesity, as well as in case of aging. To learn and grow daily like this, please do subscribe.